Guys, on today's video I'll be sharing with you guys how to collect the contraction rate and the fetal heart rate on your pregnant mommy. So basically the first thing you need to do is to make sure your CTG is working. So I've switched it on, and then to confirm if everything is working on the CTG, I'll have to check my transducers if they are working. So the first thing you do is gently tap on the fetal transducer, which is the one that is a bit round and flat on both surfaces. When you tap, there should be a reading that shows on the machine for the fetal heart rate. So maybe my pulse is gone, like guys, it's not picking up anything, so I'm dead. Hi Bob. The things are not happening. So it's either my machine is not working or something. So we tap until something happens. If nothing happens, you'll have to change your transducers. So, but as you can hear, you can already hear the sound to show that it's detecting some activity. So there it is, it's showing that it's working. And then even the one for your contractions, you gently rub against it or tap. As it changes, it shows you that it's picking up activities. So once you have detected that your transducers are actually working, you will go to your mom. By then you had already introduced yourself, explained the procedure, and asked your mom to empty her bladder, because the procedure might take up to 10 to 20 minutes. So she might need to have an empty bladder for it. So you expose only the parts that you will need, which is your tummy. So you make sure you cover your mom's breast and her private parts. And before the mother had lied on the bed, you had already placed two securing belts. In this case, we are only using one because we do not have both due to, just say this is the bed. So you will take the one for your fetus. You have already done your abdominal exam and detected where the shoulder blades of your fetus is, because you need to place your transducer between the fetus shoulder blades. So you've done the abdominal palpation, so you put the conducting gel on top. So guys, you need to bear with me. Like I said, we just don't have things are finito. Okay, let's say it's there. You will put your gel. Please keep in mind I said you put your gel there. Then you will look for the fetal heart rate. So it's not doing the things without the gel. So guys, I need to break this thing to get that gel, because it's not gonna work without the gel. So once you've got your conducting gel on the transducer, you will look for the back of the heart, and then if you have placed it well, this is what you should be hearing. If you can hear that, then you secure. So this securing belt has some holes there, like the way you'd use on your buttons. So you just put in on one hole at a time. So do that, put on that hole there. Just make sure it's still in the correct spot. If it's moving, find the correct spot again. Like in my case, you see, I can hear it, but it's not that strong. It's gone. Like, it's gone. Finally, it's gone. So if you can't find it in cases like this, you do not panic first, because you found it at first. So you just need to look for it. And then if it's a case whereby you do not find the fetal heart rate, or it's not within normal ranges, then you'll have to refer your mother for in an institution that can provide services for her, which will be a high-risk institution for pregnant women. Then once you've found the fetal heart rate, in this case my medicator is doing things, so just bear with me, you'll have to place the transducer right at the top of the fundus. How do you find the fundus? You place your hand on the xyphosternum, then gently move your fingers towards the symphysis. When you are moving it towards the symphysis, this is the first place where you feel resistance. That's where your fundus will be. Then you place your transducer there, and then it will start picking up the contractions and the fetal heart rate. So like I said, my machine is not loud enough, but you can already see the fetal heart rate there. So yep guys, it's working. That's how you will do it. You place your mom there for 10 to 20 minutes. If there is complication, there won't be a need for you to place her for more than 20 minutes, because you can place her for 15 minutes, and you can see this is a case that needs a referral. You refer your patient. So that's basically what you will do. And then when you're done, you remove the transducers and the belt, wash your hands, tell the mama or encourage your patient to mobilize. This will help push the baby towards the vaginal canal through gravity. So yep guys, watch my next video because I have a lot, and forgot to tell you there's a new family member, so do watch out on the next videos. He will be there popping information. Mwah, mwah, mwah.